entitled Comparing Models of Practice-Based Research for Healthcare Design in Large Australian Architecture Practices. And I'm excited to see this presentation because I was a participant. So over to you, Shari. I'm looking forward to hearing all about it.
Thank you. I'll just make this full screen. Okay, everyone can see that. Thumbs up. All good. Fantastic. Thanks, Michaela. And thanks everyone for joining today to hear about my thesis. I know you're all probably having lunch, so it's fine to have your cameras off and eat your lunch in the meantime, but I'd love to see your faces at the end to have a little discussion about, I guess, your experience in this space as well. So as Michaela said, I'm working in Brisbane as an architectural graduate at the moment. I completed this thesis in June, and I've tried to condense, I guess, a 40-something page document into a 20-minute presentation. So it's only going to scratch the surface, but please ask questions at the end if you like, and I'm happy to send you the thesis if you're interested in reading 43 pages. So I'll jump straight in. As Michaela said, the title is Comparing Models of Practice-Based Research for Healthcare Design in Large Australian Architecture Practices. So with a lot of thesis titles, it's a bit of a mouthful, so I'll just break it down quickly for you. As you're all very aware, practice-based research is research undertaken in a practice environment, slightly different to academic research. Healthcare design is the architectural processes and services for health facilities, primarily under classification 9A in the National Construction Code. And large Australian architecture practices are defined in this thesis as having 2 or more office locations in Australia and over 20 employees. So that's the AACA definition of a large practice. So this is a little diagram I created just to kind of give a brief outline of the entire thesis. So in Australia, there is increasing expenditure on healthcare facilities and in turn, increasing expenditure on architectural services to create those healthcare facilities. And so research can inform the design of these facilities, but often models of practice-based research aren't actually published or discussed between practices. I guess that's what we're trying to combat with this little group. So I interviewed 5 large Australian architecture practices, and my intention was to document these PBR models and thereby promote the value of PBR for healthcare design. So the primary aim of the thesis was this project seeks to explore what PBR models exist, describe how they operate, and understand how they contribute to healthcare facility design. And I had a number of secondary questions from that primary aim. So firstly, how do large architecture practices define architectural research? Secondly, what motivates a practice to undertake research, and what do they perceive the value to be? What types of research are undertaken in practice? Who is involved in the process, and how is this funded? How are the research outcomes disseminated, and what role do PBR outcomes play in the process of healthcare design within a practice? And finally, what do practices perceive to be the role of architectural organisations like the AIA, tertiary education institutions, and government bodies in supporting the process of PBR? So I've used these secondary questions as the main headings in this presentation to try and condense some of the literature and results from my thesis.
Sorry, the 5th one hasn't come up, Shari. What was it?
You can't see that one? Oh, it's to do with what practices perceive to be the role of architectural organisations like the AIA, as well as universities in the architectural courses. Okay, so just quickly about the methodology. Can you see this slide? Okay.
Yep.
Okay, great. So this thesis uses an holistic multi-case study approach, which is essentially quantitatively selecting 5 large Australian architecture practices as the case studies and narrowing the amount of variables between each case study in order to create more generalizable results. So those variables are narrowed essentially by having 2 or more locations in Australia, 20 or more employees, and making sure that those architecture practices undertake healthcare projects.
Would you also have narrowed it down to a similar amount of employees as one of your variables? Because I mean, I know 20 is the definition of a large practice, but
they can range quite a bit
I'm
above
just
that.
wondering, did you do some with 20 and some with 500, or did you try and get the actual bigger ones?
Most of them are the big ones.
Right,
Yeah, definitely.
Okay.
Yeah.
Right.
Yeah.
So, yeah.
And I collected qualitative data through one-on-one semi-structured interviews. So just when I was ready to conduct the interviews, COVID happened. Please submit an amendment to my ethics application just to be able to do virtual interviews. But that worked out well because I had people all around the country anyway. And finally, all of the participants were assured the identity of themselves and their practices would remain confidential, with the hope that this would solicit more valid results. So on to the secondary questions. What is architectural research? So the first area of inquiry obviously has to do with the definition of architectural research. And the literature is really interesting actually in this area. So you've kind of got literature talking about design research on one hand, and on the other hand, you've got literature that are proponents for traditional research methodologies, and it's kind of a spectrum in between there. So I've got some interesting quotes here from various proponents. So Jeremy Till has written quite a lot on research in practice, and he says, architecture can and should be a research discipline in its own right, which both accords to the accepted criteria of research, but at the same time applies them in a manner appropriate to the issues at hand. And so that's kind of supporting the idea that there are methodologies that are specific to the architectural discipline, as opposed to shared methodologies across various disciplines. And then there's a quote down here from Biggs and Butchler, I'm not sure if I'm pronouncing that correctly. Maintaining the link between design research and traditional academic research is necessary because it will enable design to show that it conducts high quality, rigorous academic research. And so they're kind of proponents for making sure that the research that architectural practices do are accessible to other disciplines based off the methodologies that they use. And so just a very quick summary of some of the results that I achieved. Only one participant stated that their practice aligned closer to design research methodologies. And the other 4 participants noted that personally they aligned with more traditional methodologies, but they noted that within their practice there were a variety of different definitions. And so I guess the conclusion from that was that I couldn't be conclusive about whether all large practices had a particular definition of research, and that the debate persists even within practices. So the value of practice-based research.
So yeah, sorry, can we just go back to the last slide?
Absolutely.
Yeah, so was this self-reported information, or did you do some kind of test to find out whether they aligned closer to design methodologies?
This is what the participants reported.
This is a self-reported assessment. Right. Yeah, no worries. All good.
Yeah.
Yep.
Could I ask a quick question?
Absolutely.
What was the definition of design research versus traditional research?
So design research, I guess, is not necessarily the definition of research itself. So all of the all of the literature tended to agree that research was the production of new knowledge, but they differed on what kind of methodologies could get you there, essentially. So design research focused on projects themselves and buildings themselves being a production of new knowledge, whereas traditional methodologies related more to social sciences and science aspects of research methodologies. Is that
so? Were they? I mean, when practices were saying traditional, they were thinking things like surveys and literature reviews and talking to people.
Right. Something more rigorous, essentially.
Yeah. Okay, thank you.
That's okay. Hopefully that answered your question. So on to the value of practice-based research. The literature spoke generally about 2 specific areas of the value of practice-based research in architecture. So the first area is about improved architectural outcomes. So practice-based research can improve the design process by testing outcomes, feeding the results into future projects, and encouraging innovation in this process. And that's a very quick summary of the literature that I found. Professional development and contributing to the body of knowledge was the other area of literature about the value of PBR. So while knowledge may generate a profession, the profession only continues if they maintain exclusive rights to their knowledge base. And this section also spoke about having open source knowledge as opposed to knowledge for competitive advantage, which I'm sure we're all quite familiar with that difficulty in the industry. And so very briefly, some of the results from this line of questioning, the participants spoke about the motivation for undertaking practice-based research. So undertaking research for healthcare design in the 5 practices strongly correlated to the need to increase their depth of knowledge for increasingly complex health projects and communicate this knowledge to their client base. And so this is very specific, I guess, to the healthcare design industry itself. And they also noted that, 3 of the practices said that it was really a top-down approach to establishing PBR in their practices. And I think that aligns closely with what Alex was talking about a couple of months ago in having that support from management to undertake research. And another area of the results was the perceived value. And so that aligned quite closely with what I found in the literature review, but there was also a focus on improving the practice as a business. And they all also noted that the value was contributing to improved built outcomes. All participants noted there was no requirement to qualify or quantify the benefit of PBR, and all agreed the benefit is inherent and contributes to return client business. So onto current models of practice-based research. These are some of the studies that have been done, and I guess I used as a basis for designing the methodology for my study. I'm sure you're quite familiar with some of these works. Hensel and Nilsson have released 2 books about practice-based research. And I guess the first 2 studies here, also the one by the Royal Institute of British Architects, they talk broadly about a range of practice sizes. They also talk about practices internationally. And they don't necessarily focus on one sector. Whereas Stead and Cargio-Grady took that a bit further, and they made sure it was just large practices within Australia. They had a roundtable discussion. And my study methodology really builds on that to have a specific sector within that, as well as de-identified results.
Can I just ask you what was the publication called? The Royal Institute of British Architects.
It's called Knowledge and Research in Practice. Sorry, that's a bit blurry on the screen there.
Thanks.
That's okay. I can send you a link after if you like.
I think I might have actually read it, and I was just thinking, I don't recognize it. So yeah. knowledge and research
in practice.
In practice.
Yeah. And so they got survey results from various different practices that had all applied for the President's Award for Research.
Okay, and didn't they actually make a survey as well? Or is that a different publication?
They made the survey, that's right.
Yeah. So it's a good job. They did really well.
And so these are very briefly some of the results. So it was a real mixed method of research from the participants and their practices. So grouped into these little categories, we have external research, so university partnerships, grants, information from external networks. That seemed to be quite specific to the health industry. So lots of the participants were a part of various health networks, such as the Australian Health Design Council, HDC, yep. And so they gained a lot of information from those networks. They attended conferences, discussions with medical professionals, and then they also spoke about desktop and precedent studies, so more informally reading and absorbing existing research, reviewing precedent projects, focus on evidence-based research, and study tours, both formal, informal, national and international.
Yep.
And then post-occupancy evaluations. So some practices undertook more formal evaluations and some more informal, which is essentially walking around hospitals, chatting to clinicians and administrators. All the research was primarily internally funded, which I'm sure you're all familiar with very limited government funding. How are we going for time, Jacqueline, Michaela?
Don't worry about it. Technically it's up, but I know you've only got 2 more points.
Yeah,
so it's all good.
Absolutely. Okay, great. So fourthly, research outcomes and healthcare design process. So the fourth area of inquiry is more specific to understanding how research outcomes can inform that process of healthcare design facilities. So the literature review looked at what research existed in this space, touching on evidence-based design, post-occupancy evaluations, and a desktop study. Hamilton's got an interesting opinion on desktop studies here. They constitute a limited review of the literature and an equally limited effort of benchmarking similar projects. It does not often rise to the standard required of a serious researcher or scientist. And so his commentary is essentially it's not rigorous enough.
Yeah, and a lot of people would say it's not actually research.
Absolutely. Yeah. And so I've got 4 main categories of results here. So firstly, internal dissemination. There's a mixture of active dissemination, which is to do with health sector meetings, working groups within health teams and mentoring processes, as well as passive dissemination like internal digital platforms, the intranet, and emails to staff. In the design process, they spoke about commencing with desktop studies, conversations with clinicians and administrators, so that's more to do with user group studies. Experience in health is vital, is really what I got from the participants. To have that long-term experience was extremely necessary, and yet none of the participants noted that as a form of research itself, more tacit knowledge kind of information. Staff with qualifications in the health field, that was quite interesting. Quite a few of the participants noted that they had staff in their practices that were previously clinicians or nurses, and they had that background knowledge of the industry, which really helped in the design process. And lessons learnt from previous projects as well, having that debrief after a project to improve future projects. As for external dissemination, 3 of the 5 practices don't formally disseminate research outcomes. Now that's not necessarily because of competitive advantage, and I'll talk about that in a moment. But one practice noted competitive advantage is not necessarily gained by withholding the research, but rather showing the practice is proactive about undertaking research and that there is deeper knowledge behind that published research. And there's a lack of knowledge sharing. So not necessarily because of competitive advantage, but participants found that there were difficulties relating to client confidentiality on projects. So they weren't able to release any kind of research on those projects. And that's not necessarily specific to the health sector. Clients withholding POE results, so specifically public health government, would undertake POEs and not release those to architects. And I found that probably the most interesting part of this whole thesis for me. I didn't realize there was that lack of a feedback loop to architects in that process. And POE results not necessarily being architecturally focused. So if they actually did gain any of those POE results, they obviously were done with different goals in mind rather than design or architecture. And finally, tertiary institutions and professional organisations. So the literature review investigated what kind of support the AIA offered to its members. Just briefly, the AIA Code of Conduct, Professional Code of Conduct, states that architects are expected to strive to contribute to the development of architectural knowledge. However, the most recent research policy released by the AIA was in 2009, so a little over a decade ago. Conversely, REBA actually provides a plethora of resources to their members for practice-based research. So they have a research in practice guide, for example, that indicates both design research and traditional methodologies and how to undertake those in practice. They also have a guide as to how to apply for research and development tax credits with the government. There's quite a lot of resources on their website. They also do awards, President's Awards for research. And I had a quick look at Australian universities and studies to do with architectural courses within those universities. So Oswald and Williams undertook probably the first comprehensive study on Australasian architectural courses. And this study was followed up last year by the AACA. So it's a longitudinal study of architectural courses, and exclusion of specific research subjects has persevered. So some of the results are perceptions of the AIA. 3 out of 5 participants believe the AIA is not doing enough to support practice-based research, and 2 of the 5 participants noted that their state chapters were supportive of research in practice. So more research there would be interesting to understand, I guess, take the temperature of how people feel about the AIA and practice-based research. Architecture awards, there was a consensus generally that we should have architecture awards for research, and someone went a little further to say, well, we should have more rigor around normal architecture awards as well to understand why these buildings are being awarded. So here's a quote from a participant. Why are these buildings considered to be really high quality infrastructure, social infrastructure, and what is not? It would be really great as an architect to understand why they are considered good and actually have some data around it. And finally, graduate knowledge of research methods. So there were mixed results here. 2 of 5 of the participants didn't believe graduates had an appropriate understanding of architectural research methods, and 2 out of 5 believed they did have a good understanding of research methods. So I found that aligned with their resourcing strategies and collecting students from particular universities, and those practices understood the research ethos from those universities. But more research there would be really interesting to understand student capabilities and graduate capabilities. So 2 more slides left. Quickly on methodological limitations. Grouping the results under organisational categories instead of by individual case studies may have decontextualised the results, but I did it in this manner rather than doing practice 1, practice 2, practice 3, because grouping the information in that way may have identified those practices. Increasing the amount of participating practices would have improved the generalizability of the results. I only had a year to do this study, and obviously it's only a master's thesis. Increasing participants within practices to include multiple locations, as well as various hierarchical positions, would strengthen the constructivist approach and verify practice perspectives. And a second round of questioning would have been really great to delve deeper into emerging categories. Sometimes, you know, your third participant will come up with a new piece of information, but you can't go back and ask the first and second participant that question. So that would have been really great to do. And finally, avenues for future research. So a nationwide study to understand what practitioners expect from the AIA in regards to practice-based research would be really interesting. Continuation of the longitudinal study on Australasian architectural education, including deeper understanding of how research is taught. And parallel studies could be undertaken for other architectural sectors, so education or commerce, to confirm the nuances regarding research for healthcare design. And that is me done. Thank you.
Fantastic, Shari. Thank you so much for presenting that. I think it's really important, the work that you've done, and I would highly recommend that people get hold of the full report and have a read, because there's lots of detail in there that obviously we don't have time to go into today.
Absolutely.
But it's a really great look at what's going on just in health. There's a whole lot of other stuff going on, obviously, in different sectors, but it's great to get that idea of how people are feeling about it. I'll throw it open to the floor in a sec, but I just thought I'd make a couple of comments about the AIA. I think the findings that you've got about the AIA are particularly interesting. And Gillian's not here today, but Gillian Armstrong has recently taken on the role of policy and research, head of policy and research at the AIA.
Oh, she did get invited. She just obviously couldn't make it. Yeah.
And I haven't had a long discussion with her about that, but I think it's notable that there is that position now,
Yeah, absolutely.
and that there may well be some action coming from that.
Yeah, I have spoken to Jill,
Great.
actually. Yeah, and she was talking about creating a new research platform on the AIA website.
Yep.
Yeah, which was really great to hear.
Cool.
So everybody keep an eye out for that platform. It's coming. It's going to be a series of links and documents and various other
Resources.
things to research that is going on in practice and academia to an extent, I would imagine too. I'm not sure. So does anybody have any questions for Shari?
Yeah, I've got a couple. First, I was just wondering if you've thought about disseminating this through the AA journal, like in a kind of condensed written up form, because that would be great.
Yeah, so that's why I contacted Jill actually. So definitely in that process and would love to do that.
Yeah, cool. Because I think in the journal as opposed to on a website would be a really good way to go.
I agree. No, completely.
Second question, purely a methodological thing.
Sure.
How successful do you think the de-identified data is, given that I could probably, with almost 100% certainty, name 4 of the 5 practices you will have interviewed? I wouldn't be able to pick the 5th at this point.
Please don't name them.
No, I won't, but I'm pretty sure if I read through your report, I might also be able to pick who said what quotes if you've got them. So, you know, in a context as small as Australia, like, I mean, given the experience you've now got, do you think we just have to accept this, the fact that it's all going to be identifiable at some level?
Yes, and I would much prefer to do identifiable. I think because it was a master's thesis and I had to do an ethics application, it was easier to do it that way. And there was the thought that there would be, well, I guess the practices don't know me from a bar of soap, so that was easier for them to offload that information knowing that there was less consequence for them. But in the future, I would absolutely love to do identified. Because,
I mean, I think also for me, there's a kind of curious disconnect whereby in academia, everything should be de-identified, but in architectural practice, you want your IP credited. So I think there's maybe some work to be done in how we balance those two things, bring the research together.
Yeah, and that leads me to asking you, could we actually have your report, your results?
Yeah, absolutely.
Are you offering it to everyone or just the people that participated?
No, yeah, I'm happy to send it out to the group. Absolutely.
Okay.
Yeah.
I'd love to have that. And do you mind if we share that internally?
No, that's fine. Yeah.
Oh,
yeah.
That's all good.
Yeah.
Thanks.
If people have the time to read it.
Yeah, no, I think it's really a really great and important sector to be focusing on right now, particularly for our company.
Also, sorry, one more thought on that whole dissemination thing. Given that Australia is such a global leader in healthcare design, it might even be worth pitching it to the RIBA journal.
Okay. Yeah, great. Thanks, Rebecca.
Have you, I'm assuming that the RIBA is still offering their, or still promoting their research award.
Yep. Yeah. Absolutely. Yep. I think it's a yearly award. I'll have to check.
Yep. Because if you, certainly a few years ago, they were publishing an abstract of all of the shortlisted entrants. So that's another way to disseminate it.
Okay, great. Yeah, I'll make a note.
Cool. Anybody else got any questions?
Or does anyone else work in the health sector? I'd love to know if people share those kind of experiences.
Well, Rebecca.
Yes.
Yeah. I don't have any of the people in Cox here at the moment in this session that work in health. So I don't know about the other companies.
Yeah. I'm really hoping, Jacqueline, that now that Cox are working on the Footscray Hospital, that there'll be some health research to come out of that project.
You know, everybody knows now.
Everybody knows.
Yeah, so for your information, we did a major research proposal, which may or may not be part of it. That's one of the things that we're, what do you call it, negotiating at the moment, but we did prepare a big research proposal, which is very, very exciting for me. So I'm really, really pleased we got that job. Probably a few other people here as well. So yeah, it's a very topical topic for me, Shari. Thank you very much.
Welcome.
And Shari, have you had an opportunity now that you're at Jacobs to do any more research or plan any more research?
I've absolutely floated the idea.
Great.
Yes, so we're hoping to undertake a bunch of post-occupancy evaluations, actually, which will be really exciting. We have a couple of projects that have been occupied for about a year now, so it's the perfect time to get that underway.
How do you do your post-occupancies? Because there's a few different ways of doing them. What sort of information are you collecting?
I haven't done any yet, and we haven't created the framework, but I'll let you know when I do.
Because I used to teach it at Monash. It used to be very qualitative, but I'm now going to go over to quantitative because you can get really good data using what they call Likert scales.
Yep.
Like comparing before and after, for example, so pre and post. So I don't know if you want to have a chat about that sometime.
Yeah,
let me know.
Fantastic. Yeah, absolutely.
Cool.
Does anybody else have any questions?
Can we have everyone on screen to take a photo? Would that be possible? Let me see, print screen.
Do I have to do my hair first?
What hair?
No.
There it is. Just here we go. Oh, smiley. Thank you. That was lovely. That was lovely.
Excellent. All right. Well, if nobody else has got any comments or questions or observations, I'd just like to say thank you to Shari for sharing her work. It's really great to see that sort of stuff going on. There's no doubt that there's a bit of momentum for research in practice gatherings. So that's really, it's good to have some research behind the research. Thank you, Shari. And next month, I believe we have Rebecca presenting for us.
Yes.
She's looking surprised.
She forget. Yeah, she did. Yeah. What date is
Rebecca, it's in a month, Rebecca. Now you might have forgotten, but if it is too much, we can make it January.
No, that'll be totally fine.
Yeah. All right.
Absolutely.
So we either myself or Richard, who you can see on the screen, Richard Lee, will be hosting that session. We're not sure yet. We're just going to work it out. We're kind of sharing it around a bit. But I really look forward to that too because of the healthcare theme. It's going to be very exciting. So thank you everyone for coming. And thanks for hosting, Michaela.
Yeah, thanks, Michaela.
Pleasure. We'll see you all next time.
Okay.
See you later.
See ya.
Thank you.
Bye.
Everyone.
Bye.